I've been a nurse for over 10 years now, and I absolutely love my nursing journey. I never imagined that I would be in the position that I'm in now. Not a lot of providers are talking about sexual health. I do believe that when it comes to sexual wellness, especially with women, we're very emotional. And I think if we are mentally shut off from our partner, then it makes it hard to connect physically. This can happen as young as 40. I've seen even some that were younger than 40 have issues with erectile dysfunction. It's a blood flow issue, and it's usually the first sign that there's something going wrong that's either heart related or high blood pressure. So a lot of times men will keep this to themselves because they feel embarrassed by it.
What is your approach to kind of weight management for your clients?
There is no magic when it comes to weight loss. And a lot of times people think, especially women, we think that, we've gained 20 pounds overnight, so we can lose 20 pounds in 1 week. It's a gradual thing. Half a pound to 2 pounds a week is realistic. Other importance of a weight loss program is you have to eat. I teach people to eat. A lot of people think starvation. No. In order for you to burn calories, you have to eat food. You have to fuel the body.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nelo. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hey guys, welcome back to the Nurse on Purpose podcast. Today, I'm joined by Veronica Brown, a nurse with over 15 years of experience in healthcare and a passion for helping people feel whole again. From urology to emergency medicine, weight loss to sexual wellness, Veronica's work is rooted in science and driven by heart. With advanced training in cellular medicine and specialties like the P-shot and O-shot, she helps couples reconnect, rebuild confidence, and rediscover intimacy. Her message is clear. Sexual health, self-care, and being present in your wellness journey are non-negotiables, and we're here to talk all about it. So you're welcome to the podcast, Veronica.
Thank you so much.
Thank you for being here. It's been a long time coming, girl. We have been trying to get together for months. You're a busy woman.
Yeah.
I want people to hear this message today because I think it's sometimes a taboo topic, talking about sexual wellness and things like the P-shot and the O-shot. So let's start off by really delving into your journey. Can you share your journey into nursing? And then after, we'll talk about what inspired you to pursue this kind of line of business that you're doing now.
Yeah, so I've been a nurse for over 10 years now, and a nurse practitioner for almost 5 years, I believe we're going on. And I absolutely love my nursing journey. I never imagined that I would be in the position that I'm in now. When I first went to nursing school, I thought that was going to be it for me. I got my master's degree, but all of my peers and some of my mentors encouraged me to go on to pursue an advanced degree as a nurse practitioner, which I absolutely love, and grateful that I had that support to encourage me to move on and to further my degree and career.
That's awesome. When you got your nursing degree, what units did you work on first?
So my first, for one, I thought I was going to be in ICU or the emergency room because I like the craziness and all the critical stuff.
Really?
I do.
My goodness.
Yeah.
You seem so different to me. I feel like we're similar in our personalities, and I'm totally not that person. Like, don't put me in the ER. Don't put me in the ICU.
No,
I don't even want to be in the hospital.
No, I knew.
So that's
I knew that's where I wanted to go. So, as a new grad, you don't get all of the opportunities that you want So I did
Yeah.
start off in progressive care cardiac, which it was a really great foundation for me. And I'm glad that I did that because once I entered into working in an emergency room at a level one trauma hospital in the city of
Mm.
Detroit, which
Oh
was
Lord.
like kind of intimidating,
Yeah.
I'm glad that I had that experience. I
Mm.
think without it, I don't know how I would have maneuvered the system, and working as still a new nurse because I only had a year and a half of experience when I moved
Mm.
on to the emergency room. So
Mm.
yeah, and I've been there and I never left.
Wow, that's
Hmm.
amazing.
Hmm.
And then that's it was at that point that you continue to pursue that master's degree
Yeah. So like
after.
when I was, I think 4 years or something into me being a nurse in the ER, then I went on to pursue my NP degree, which was another great opportunity for me as I furthered my career. I had a really good experience in my NP program, and I'm really glad that I did it. So from the emergency room, I became, I was already in the emergency room, and then I became an NP. I went into
Mm.
substance abuse,
Mm.
urology, and then also sexual wellness, which I absolutely love. And I have done some
Mm.
family as well.
That's
Yeah.
wonderful. And then eventually you decided to be this like big bad businesswoman, okay?
I don't know who told me to do that, but
Really?
here I
You're
am.
thriving though.
Here I am. Yeah. So my business, the Wellness Lounge, is located in Canton, Michigan. It really started off, I just wanted it to be an IV therapy place where people would go if they were feeling sick and they didn't want to go to the ER. They had something minor going on, whether it was a hangover, a cold,
Mm.
or maybe COVID, then they
Yeah.
could come to me. But then after talking with some of my really good friends, they're like, no, you should offer weight loss. I have a background in
Mm.
nutrition, which is what I did before I became a nurse. I worked as a nutritionist for almost 5 years in long-term care, and I also did some research at U of M Hospital. So, I'm like, yeah, I should tap into that because I've always been like really interested and really health conscious overall. I think
Mm.
it's important to be in front of your health and not so reactive to it. So once I added in that component of like weight loss and nutrition counseling, then my business started to flourish even more. And
Wow.
then adding on to that was the sexual health because not a lot of providers are talking about sexual health. And with my
Mm.
urology background, meeting with men and women every day, all day, some of them in tears, some of them that are just, at their last breaking point of what they can do to better their sexual health. And it can be very
Mm.
frustrating when you have a partner that you
Yeah.
actually love and like because that's important and you want to be intimate with them but you can't
Yeah.
because your parts
Yeah.
aren't working the same way that they previously did.
These two.
Hmm.
Yeah. That's so interesting that all the experiences that you gathered all
Yeah.
throughout your nursing career really now came in handy
Hmm.
with your business. Nothing, no knowledge is lost. And this reminds me what you were saying about the intimacy piece. I worked with a company, and in that company, I would do evaluations for my patients. And a lot of these patients, what would I say it? The side effect of what they had been through
Hmm.
was that they lost a lot of sexual
Oh
libido,
yeah.
which was affecting their partners.
Hmm.
And like you said, a lot of them were they felt like failures,
Yeah.
because these were young men who really wanted to be there for their
Hmm.
partners, their wives,
Hmm.
and they couldn't do it.
Yeah.
And they didn't realize that there was something else that could be done for
Hmm.
it. So I'm pretty glad that we're having this conversation to address what can people who want to be intimate with each other but have lost either the urge or just the vigor, and I'm talking in a biological sense, right?
Yeah.
What can they do to really spice it up and reconnect again with their partners? So For people who don't know, let's talk about that sexual piece first.
Yeah.
What is the P shot? What is the O shot? And what are some of those sexual wellness services that you provide in the Wellness Lounge?
Yeah, so I do believe that when it comes to sexual wellness, mentally, your mental, especially with women, we're very emotional. And I think if we are like mentally shut off from our partner, then it makes it hard to connect physically. I meet with different people with different reasons as to why they are at a, standstill in their sexual relationship with their partner. And we talk
Mm,
about those things and we come up with plans and ways that they can better, even if it's just pleasurable for themselves. So when we think
mm,
about the O shot and P shot, these are services that I offer as it's like the most natural service ever because it's basically blood that's coming from your body. And I'm
mm,
basically drawing your blood and spinning it down on a machine that separates your red blood from your gold. And the gold blood is what we inject into the private areas of both men and women
mm,
to rejuvenate that area, to kind of like wake it up. So,
mm,
whether you're having a low libido for women, whether they're having like vaginal dryness or painful sex,
mm,
we can rejuvenate that and, to increase the moisture, to increase that sensation there in that area. And then for men to increase their blood flow to the area so that they can have an erection. And a lot
mm,
of times men are not aware that, this can happen as young as 40. I've seen even some that were younger than 40 have issues with erectile
mm.
dysfunction, with gaining erections. So it's a blood flow issue. And it's usually
Oh,
the first sign that there's something going wrong with that's either heart related or high blood pressure. So a lot of times men will keep this to themselves because they feel embarrassed by it. They won't talk
mm,
about it with their friends and they're too embarrassed to mention it to their provider.
yeah.
And really, it's like a sign that, hey, there's something that's not going on. So, all the men out there, if you are having any issues with erectile dysfunction, this would be a good time for you to say, something to your primary care provider to
Mm,
mention it to them because we can do testing and things to be sure that you're not having anything like diabetes going on or high blood pressure. Yeah.
mm. So interesting. You can
Hmm.
pick up on other
Oh,
diagnoses
yeah.
just by their sexual
Yeah.
history here.
Yeah.
Hmm.
And even with,
And is this the, yeah,
I
go
was going to
ahead.
say, even with women, I know I keep hearing so many women, even some of my clients that are going through that perimenopause and menopausal state. You hear Halle Berry and Oprah talking about this, and now it's this big thing because our mothers and grandmothers, they didn't talk about these things.
Mm,
A lot of my clients that come in for the O shot, they're going through perimenopause, they're going through menopause, and some of them
mm,
are postpartum where they've just had a baby and for some reason they're not able to, they don't have as much moisture there in the vaginal area. So the
mm.
O shot is very beneficial to women, and the P shot is very beneficial to men in helping them on their sexual wellness journey.
And is this the platelet-rich
It
plasma
is, yeah.
therapy? Okay,
Mhm.
so when you say gold blood, we're
Yeah.
talking about plasma.
We're talking about plasma, yeah. So this
Okay,
blood is
okay.
like it's like the best that you can ever do for yourself. I mean, we use it for sexual health. Some people use it for rejuvenation in their face. Some people use it for knee issues, knee pain, shoulder pain. It's amazing. And
Mm.
it's
And
the
it's not
it,
artificial, it's coming from
it's
your
coming
own body.
from your own body. And
Mm-hmm.
so it's like, and that's why I say it's the most natural thing that you can do for
Mm,
yourself because I mean, you're
mm.
not allergic to the blood in your body.
Right,
So-
right,
and if you
right,
are, then we have a problem.
right. No, I don't think anyone is allergic to their own
Yeah.
blood. Okay, so breaking it down for my folks who are non-medical,
Hmm.
I'm going to try to kind of explain it in very simplistic terms,
Okay.
okay? So you draw blood from the patient's body,
I
right?
do.
However much blood, whether it's a vial, a couple
It's
of
a
vials, I don't.
vial. Yeah, it's a
It's a
vial.
vial. You separate that,
Yeah,
right?
on the
Blood
machine. On the machine.
in the machine, yes, of course. And it separates the red blood from what is called a plasma blood.
Yeah.
And then we take that plasma and we put it right back into the area of your body that needs it, whether it
Yeah.
is the
The
face,
face.
correct?
And I,
Whether it's the.
yeah, so it can be the face.
Mhm.
I had training done in New York by an OBGYN that is a part of cellular medicine. And
Okay.
so they created this for the purpose of building that intimacy back with your partner. PRP is beneficial for facial rejuvenation. We also do a vampire breast lift as well, where if you're going on a vacation or you have a birthday or some big celebration coming up and you want more cleavage, we can plump that area up there.
My
Uh,
goodness, this plasma thing is doing it all.
it does it all. And on top of that, also hair restoration. I do that. That's
Wow.
another one of my favorite services that I do is
Mm.
restoring hair. And it's not just about the hair restoration. It's not just about the injections, but you also have to talk to your clients about what products they should be using on their hair and, hair growth, what type of
Wow.
vitamins they need to help. Because a lot of people think biotin, biotin, but really vitamin D over biotin any day of the week.
Girl, I'm on my vitamin D game right now.
Listen,
So,
vitamin D is good for hair, skin, and nails. I swear by it.
yeah,
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 yeah.
yeah, absolutely. Now, with the O shot and P shot, how often do you recommend that couples get that?
Every 8 months to a year. Some
Wow,
people, yeah, it's very effective. You hit
wow.
your peak at well, you hit a peak at 3 weeks, but really maximum results you'll see within like 3 to 4 months. And so you'll
Wow.
you'll know, you'll see the difference.
You'll see the
Yeah,
difference.
I love the feedback that I get from
Wow.
my clients.
That is so
Yeah,
amazing. All right. And then now you're also into the weight management
yeah.
services. What is your approach to kind of weight management for your clients?
Yeah, so I'm more about the realistic approach, meaning that there is no magic when it comes to weight loss. And a lot of times people think, especially women, we think that, oh, we've gained 20 pounds overnight, so we can lose 20 pounds in 1 week. And
And why
that
isn't it like that though? Because when you want to gain it,
it's really
it comes
not.
right on.
It's
But when you want
really
to lose it, it's like, geez.
it's a gradual thing. It's
Absolutely.
kind of like one day you may try something on and it's like, man, I was able to fit this 3 months ago. What happened? So then that's when you start thinking, well, I can lose this weight in 1 week, but no, that's
Mm-mm.
not, logical. But realistically, a half a pound to 2 pounds a week is realistic. And the smaller you are, the harder or more challenging it may be to lose weight. Everyone is different. We all have different genes. We all have a difference in how our body is made and shaped and things that are going on within our body. So,
Mm.
and the one thing that I always teach my clients is not to compare themselves to other people. Because a lot of
Mm.
times I'll have people come and say, well, I know someone that lost 10 pounds in 1 week. Well, I don't know that person and I don't know what they're doing or what they're taking, but I do not believe that they are losing 10 pounds in 1 week.
And it's not going to be sustained
No,
though. You're just
it's
going to be
slow.
angry all the time and you have to
Right.
keep up that
It's
life.
slow, gradual. And then the other importance of a weight loss program is you have to eat. I teach
Yeah.
people to eat. A lot of people think
Mhm.
starvation. No. In order for you to burn calories, you have to eat food. You have to fuel the body. It's just like our bodies are just like a car. You cannot drive a car without gas. The body is the
Mhm.
same way. It needs
Mm.
nutrition, it needs hydration to get on through your day,
Yeah.
and to function and to have the energy to run around with your
Mhm.
kids, to be
Mhm.
active, to do different things. And sleep is also important. 7 hours of sleep a day is what studies and research show that we need to get through our days. And I know some people think they can function on 3 to 4 hours of sleep, but really you can't even think straight that way. You have
Yeah.
foggy memory, your clarity is off.
Yeah.
And
It'll get to you.
yeah, and then that also would bring on weight gain because your
Yeah.
cortisol levels are up. So
Yeah.
there's like, there's the medication and then there's the lifestyle changes. And so with my approach is lifestyle first, and then the medication is just there to get you to your goal or to help get you there. But
That's
lifestyle
nice.
is how you eat. Lifestyle is meditation. Lifestyle is
Mm-hmm.
exercise and movement. The more active, the
Yeah.
better. And it's not just all cardio. You've got to,
Yeah.
as we get older, we're losing a muscle mass. So you've got to add in that strength training. That's going to help,
Mm-hmm.
keep everything nice and tight and toned.
Mm, yeah, absolutely.
Yeah,
Now, do you also provide like
I
GLP-1
do. Yeah.
treatments as well?
Yeah,
Okay.
yeah. I think, everyone seems to think that these medications are new because we
Quick
hear
fix.
all the people in Hollywood and
Hmm.
all the housewives and everyone that made it popular, but these medications have been out since the early 2000s and probably before. And there are more
Mm,
that are in research. And, I hear both ends that people are eager to take it. And then other people are like, well, I'm not putting that in my body. But, it's an individual thing. It may not be something that is for you, but studies have shown that, at least for women, it is helping decrease the risk of heart disease, which is the
mm,
number one killer in women.
mm-hmm.
Women, we don't present like a man would when we're having symptoms of a heart attack. It could be
Yeah.
something as abdominal pain, nausea,
Mm,
vomiting, jaw pain, tingling, numbness in the face.
yeah.
Those are all symptoms that women may have that may be dismissive, like, oh no, I'm just going to lay down or take something, or even a headache. It's like, I always teach people too, if it's anything out of your norm, it is worth getting checked out.
And I mean, just letting people know too that a
Hmm.
GLP-1 is not, it's not a quick fix. You also
No.
have to put in the
You,
work.
you have to put in the work. You have to,
Hmm.
because once you stop taking that medication, whether you go on a maintenance phase or you just completely stop, yeah, with any weight loss program, you're going to have that risk of gaining the weight back. But I
Yeah.
feel like that's individual based. As long as you are, like, if it's mental and you are doing all the lifestyle changes, you should be able to maintain what you have lost, you
Yeah,
know?
for sure.
Yeah.
And I think a big part of your method is that, it's holistic,
Hmm.
it's evidence care
It
based,
is.
and
Yeah.
the goal is to help patients to maintain that lifestyle and stay motivated in the
Yeah.
long term. And you're able to do that by educating them, which is a big piece of the nursing model,
Hmm.
is
Oh,
educating.
yeah.
And yeah,
I'm big on
yeah,
education, and
yeah.
that's probably why I still work in the hospital too, because I find that people are not aware of why they're taking the medication, and that it's just that simple education. Why
Yeah,
are you on this blood pressure pill or this
yeah,
medication? It's to
yeah,
help prevent you from having a stroke. A lot of people
yeah,
stop, especially men, going back to the sexual health. If a lot of men, if they have erectile dysfunction, some of them are already diagnosed with diabetes and some have
mm,
high blood pressure. And those two things together with medication, that's going to definitely affect your erection ability, which is a lot of
yeah,
times why we see them in the ER. They've either had a stroke or have had a heart attack because they've stopped taking their medications because they would rather have an erection than save their life by taking this
right,
medication. So, see, guys, you
yeah.
don't have to do that anymore. You can get the P shot.
Get the P shot,
Come to
and it lasts for eight
Michigan, come
months.
to the Wellness Lounge and get the P shot.
Yeah, yeah, absolutely. I feel like you're so many things wrapped up in one. You're a therapist because you're discussing wellness and just mental health with these patients that come in with their, the concerns. You're sexual coach, weight management coach, hair restoration specialist. Like, girl,
All the
you're doing
things
it.
that
And primary care.
all the things I love to do.
Yes. Absolutely. If you could give an advice to a nurse who might also be looking to start their own business, whether it's in the PRP therapy space, hormones, whatever it is that they're looking to begin, maybe step out of bedside care and move into business ownership in whatever arena they decide, what kind of advice would you give to them?
Definitely have a business plan. Find a brand manager. I did have, I had a brand manager. I have mentors. I had mentors. I think that's very important when you're trying to navigate being a business savvy or starting a business, because as nurses and healthcare professionals, we are skilled in, saving lives and treating these different illnesses that come in. But when it comes to like a business mindset, that's something that's totally different. You need to have that plan. You need to have what interests you. What are you most passionate about? Don't just go into something for money, because then you're going to find that, this isn't fun. Being a
Mm,
business owner is more than providing a service. You have a brand, you have products that you have to buy, you have training that you have to do, and then people that you have to trust to come and help, run your
yeah,
business. So those are
yeah,
things that I would definitely encourage that they do. What's their
that's
purpose and
wonderful.
why they want to? Is this something that they want to do just for now, or is it something that they want it to grow into a brand? That's
Yeah,
something to think about.
yeah.
Mhm.
For sure. Finally, kind of wrapping it up with our discussion here before we move into our media segment. Yeah, because I've enjoyed this. And I just really love that, we get to showcase this part of nursing to the world,
Yeah,
business side, and, the hormone therapies, understanding that it's a natural
it
thing. It's not
is.
something that needs to be taboo,
No,
and it doesn't need to bear the stigma.
right.
So I think that, what can you like for people who feel like it's a no-go area, it's a no-go topic because they just don't want to expose themselves in that way.
Mhm.
How do you create that safe space for patients to discuss their concerns and overcome the stigma or hesitancy about seeking help for like sexual wellness concerns?
Yeah, I think because I'm so comfortable with discussing the topic of sexual wellness, because it's something that's really important, that it just provides the opportunity for me to make others comfortable. And especially with working in urology, as with me walking into a room and speaking to a man and them seeing me like, oh, I thought I was seeing a male that was coming in, but no, it's me. And once I start talking with you, people become very comfortable instantly with me. It's very individual based. It's just you and I that's there. And the only way that someone will know you're there is if you tell them. And it's
Mm,
really just a discussion. I don't force the O shot or P shot. There are other things that I have that can help with their sexual wellness journey. That's not necessarily those things, but I do highly recommend, just because it's a quality of life. You want to be intimate with your significant other if medications aren't working. Even lube, I have the best lube ever that I offer at
mm,
my
wow.
facility. And people, when once they start using it, they love it. So
Yeah.
I would just say that I create a very safe, inviting space, and it's just
Mm.
me and them.
Yeah,
Yeah.
make it a conversation
Yeah.
that is just casual and normal,
Yeah. Yeah.
make them feel comfortable
Hmm.
to talk about it. And that's wonderful, because sexual health is health,
Yeah.
and it does affect our life,
Hmm.
in one way or another. So thank you for sharing that. I really do like the piece about the postpartum
Yeah.
dryness
Oh, yeah.
because a lot of women may experience this, but they don't know what exactly is going on with their
They
body or that
don't
this is
know.
normal or that there's anything that can be done about it.
Yeah.
And they just suffer in
And they
silence.
don't have to.
So yeah, and they don't have to. So really grateful. It sounds like you have a rewarding life, a rewarding career.
Thank you.
Where do you see your practice going in the next 5 years? And where do you see like PRP and sexual, PRP therapies really going and evolving with the future of wellness and medicine.
Yeah, it's funny that you say that about the PRP evolving because Dr. Runel talks about that a lot. And
Mhm.
this is going to be something of the norm. You know, people are already getting PRP services for sexual wellness and definitely for hair restoration. That's been around for years. The sexual
Mhm.
wellness piece is definitely new. And not a lot of people are comfortable with doing the actual procedure. You do have to have the training, and then you would have to be either a nurse practitioner or a physician assistant to offer those services. And as far as my business and where it will be in 5 years, I'm hoping that it is beyond me providing services. I want to do more speaking engagements, more group things as well, and just expanding it into maybe I'll be on, one of those big news stations one day. I'm speaking all of
Yes.
that into existence. So,
Yeah, let's do it. Well, speaking of media, let's talk about media and portrayals of nurses in the media. What are your thoughts?
well, it's funny that you say that too because I used to be really big on all of the medical shows like Grey's Anatomy, ER,
Hmm.
stories of the ER, like all the medical shows. But when the pandemic came about, I got really sick with COVID during that time. And I was even at one point thinking that, I was going to have to switch careers because the thought of me going back into the medical field was like, it made me sick to my stomach. Just because I had such a bad experience with COVID
Hmm.
personally. And so I stopped watching those shows and
Yeah.
I never went back to watching them again. But then
Hmm.
when I did at a, when I did watch them, just some of the things were like, okay, you have someone that's on their breathing, supposedly that's intubated, but they have just a regular, nasal cannula,
Yeah.
in their
Yeah.
nose. Like, okay, they're not intubated, obviously.
Yeah.
Just
Yeah.
things like that. But when it becomes into the world of reality, I think that some
Hmm.
people think that nurses are mean girls and that we look down upon others who are not nurses, which I think that's an individual experience. I don't think you should group us all into that
Hmm.
category that we're mean because
Yeah.
I don't believe that I'm mean. I'm very like,
No, you're not.
you
You're out here saving people's
know,
lives,
I'm out
girl.
here saving lives, okay? Let's be clear. And I like to have a good rapport with my peers. I feel like if I'm working in the ER or if I'm working in a hospital and I'm spending 12 hours of my day with you, you're going to like me.
We're gonna make you like me.
I want to make you like me, okay?
Hmm.
But I just say, be nice to a nurse. We're not all mean girls.
Yeah.
And I actually like what I do. I think some people go into nursing thinking that we're going to make all this money, and that's not the case for everyone. And
Hmm.
it's really not the case. But
Hmm.
you really have
That's not why
to.
you should be going into
No,
it,
it's
at least.
not for the money. You have to first be a people person. You have to know how to communicate and have great bedside manner. Be sympathetic and empathetic toward your patients and their families too. That's important. Your delivery and how you interact with people, it says a lot about, who you are and your character.
Yes.
You have to separate your personal life when you go into the hospital and wherever you work separate from your job. You don't want to bring that there, and vice versa. You don't want to bring work home either. So
Yeah.
yeah.
Yeah. Absolutely. Thank you. Let's play our game, Veronica. Are you ready? Are
Okay.
you ready for
I'm ready.
this? All right. So I'm going to shake my jar and I'm going to pick out a category, and you, my dear,
Mhm.
are going to turn into the writer of your own show,
Oh,
and just create the kind of picture that you want nurses to be portrayed, or the kind of light that you want nurses to be portrayed in, based on the movie category that I pick out.
okay.
Do you get
I
that? All
got
right,
it. I
ready?
got it.
Okay, here we go. Oh, wow. Okay. This is interesting and different. Your category is musical.
Oh, okay. All right. So first of all, musical. What we're in Beyonce's season right now. So
Please, what is Beyonce season? What is that?
that means that she has her concert, her tour going on right now.
Oh,
So
okay, sure.
when I think about musical, I think about the nurse as like, Beyonce. So when people think about Beyonce, if you've ever seen her perform, or whether it's been on TV or at a concert,
Mm,
you know that you've been in her presence. Like she puts
mm,
on a great show. So I think like
mm,
when you think about nurses compared to that, I feel like for me, when I am in contact with my patients, they know that they've had the Veronica experience because I'm going to
mm,
be that nurse that go out of my way. I'm going to, if your food comes and it's cold, I'm going to go warm it up. I make the best
mm.
oatmeal for all of my patients because I put all the cinnamon in there, the butter. I have it all melted and it's gone. They're like, that was so
Yeah.
good. Yeah, because I'm going to do that. I'm going to put ice in for your water. I'm not going to bring you warm water unless you request it. I'm going
Unless
to,
you want it.
I might fluff your pillows too, get you all warm and cozy in your blankets.
Mm.
I'm going to make you comfortable.
Are you going to be singing while you're
And
doing
I
this,
do,
girl?
and I
Because this
do
is a
sing, and
musical.
sometimes it comes out because I sing all day. I have a friend, one of my best friends, when we're together, that's all we do is sing everything.
Is saying,
So,
okay, so
yeah.
we'll be
So
singing through it
I'm
all.
going to be singing. It's going to be a joyful, happy experience.
Absolutely. Thank you so much. Okay, this is my last question. If
Okay.
you could recommend someone to be a guest on the show, who would it be?
Oh, that's going to be my bestie sister, Dr. Ashanti Coleman. She is a
Mm,
nurse practitioner in Memphis, Tennessee. She
mhm.
also has her own clinic as well, her own med spa, Rejuvenate 901 in Memphis. And so I would definitely highly recommend her.
Awesome.
Yeah.
Thank you so much for being here. And where can people find you to connect with you and
Mhm.
connect with your business and all of the good stuff
Yes,
that you're
please
doing?
follow me on Instagram at TWL by B Brown. I can also be found on my website at twlbybrown.com. I'm also on TikTok as the Wellness Lounge and also on Facebook as the Wellness Lounge by Veronica.
Awesome. Awesome. Thank you so much again for being here.
Thank
This has
you.
been really an insightful conversation. I think people will learn a lot. It's been a powerful reminder that wellness is not just physical, it is personal, it's emotional, and of course, it is intimate. Thank you for bringing just the wisdom of your experience and the heart that you have toward people, healing them in every capacity to today's conversation
Mhm.
and showing us that when we are present in our health, everything else begins to align. Thank you guys so much for tuning in. And I hope you've had just a great time listening to this conversation, just like I have. Please like, share, and subscribe. And I'll catch you in the next one. Bye bye. Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.